He who studies medicine without books sails an uncharted sea, but he who studies medicine without patience does not go to sea at all. Moorfield Academy's Patient as Teacher Symposium is based on this one principle, that the value of medicine actually comes from treating the person behind the condition, rather than the condition itself. Textbooks alone fall short, as faceless concepts lack the gravitas to aid memory, whilst the face itself, quite evidently from this event, is more than the sum of its parts. An acute presentation like a chemical injury wouldn't normally belong in the same remit as a rare genetic disorder such as Aniridia, but they do for this patient. How an alkali injury from a ruptured airbag helped to clinch the incidental diagnosis of isolated Aniridia is a unique experience of an individual that cannot be recreated in hypothetical case-based discussions. Memorable is one thing, but not following the classical clinical picture is another. It is especially rewarding when one disease informs the pathogenesis of another, how the progressive stromal haze set off by the alkali burn is perpetuated by the limbal stem cell failure inherent with Aniridia cements the link between these two ophthalmic conditions. Photophobia is a central symptom the patient described, something that only became obvious to him after this traumatic event. With the sun's reflections made unbearable by his condition even hindering his livelihood at work, you would think it'd negatively affect mental well-being as well. Despite the corneal chelation and daily lubrication therapy needed for his keratopathy, psychological counselling or support was never on his mind, even though he's acknowledged that his vision would only worsen over time. This matter-of-fact attitude is admirable, exposing a deeper level of introspection that a simple ice could only tease at. To be more specific though, what I'm getting at here is that this patient-to-teacher symposium offers an educational yield akin to an hour-long psych history. In lieu of adverse childhood experiences, what you have is a full first-person analysis of how an ophthalmic disease shapes their life and how they think. For instance, his stoicism may either belie a stress reaction of being numb to visual disturbance or pain, or the more likely result of him coming to terms with his eye condition. The format of consolidating the patient's expertise with electrochemical injuries gives context to the content earlier in the program, in such a way that even seemingly dull concepts like the Dewar classification system had more weight. Diagnostic scoring systems can be difficult to learn out of context, but the opportunity to surmise that the patient has, at worst, a grade 3 Dewar keratopathy from the 6 clock hour fibrovascular growth commits previously abstract information to long-term memory. With the patient's face seared into my mind, the mind palace itself becomes more visceral as the treatments of sodium citrate and oral tetracycline are more profound than just a slide on a PowerPoint and actually play a part in the patient's story.